You mentioned that you're 32 weeks along and starting to get anxious about labor and delivery, and I can totally relate. When I had my first baby, I had actually been a labor and delivery nurse for 3 years and seen countless deliveries. I knew exactly what I was in for. But I remember taking a patient downstairs to the mother-baby unit after she had delivered when I was about 20 weeks along and having this internal panic attack, knowing that I was going to have to do what she just did to get the baby out. But of course, I knew there wasn't any time for irrational thinking because it was a little bit too late for that. And I think one of the beauties of pregnancy is that you get so uncomfortable by the end that you're willing to do whatever it takes to get them out, even go through labor and delivery. So down the road, you'll probably start to feel a little more uncomfortable and start to get that feeling that you're just ready to be done. And I think that is, again, one of the blessings and beauties of pregnancy in disguise. There are definitely some things you can do, though, to prepare for the experience. And one of the best things is to take a prenatal class. You're at the perfect time to take one. I talk with your OB provider and they'll point you in the right direction. They'll tell you what classes are available in your area. And in that class, you'll talk about things like what a contraction feels like, when you should go to the hospital. Maybe you don't need to run to the hospital, but you should get checked out in the doctor's office for certain things. They'll talk about your cervix and what all those numbers mean when we rattle them off and what we have to do during labor. Like if we check your cervix and you're not changing, sometimes we have to break your water and start Pitocin. So what is that all about? And maybe you'll have to be induced because you're not starting on your own. What can you do for pain? There's basic breathing relaxation. There's also things in the hospital like IV medication and epidurals. We talk about all the different birth scenarios that you might possibly encounter, like episiotomies, forceps, vacuum, C-sections, as well as the IVs and monitoring, all of those things that a lot of people are afraid of. We tell you the reason behind all of those things, and that kind of takes the fear factor out of the question. I always tell the couples that come through my prenatal class that I hope to alleviate their fears when they come, but sometimes we create some by telling you different things that you might encounter. The general population thinks that labor and delivery is smooth all the time, but that's thanks to modern medicine. Take baby being too big for a mom's pelvis, for example. In medical terms, this is called cephalopelvic disproportion, or basically the baby's head is too big for the mom's pelvis. And she might labor for hours and hours and never dilate, or she might even get to 10 and push for 2 hours and still need a C-section because the baby won't fit. This is the #1 reason why moms need C-sections. Now, back in the olden days, in the old midwifery books, it said for this condition, comfort mother till she passes. And of course, that's the worst case scenario. So I think what prenatal class does for you is help you go into the process with an open mind. Hopefully when you leave, you're not thinking that a C-section would be the worst thing for you. In the end, you know that all the things we do for you in the hospital are done in order to help achieve good outcomes. Our goal is a healthy mom and a healthy baby, and we're assuming that's yours too. So you learn about all these different things in class, as well as things to watch for while you're pregnant and when to get checked out. For example, a few months ago, I taught a class where we were discussing preeclampsia and the different symptoms associated with it. And a girl came up to me afterwards and said, I've been experiencing those symptoms. So we checked her blood pressure. It was really high. And she actually ended up having her baby a couple of days later. And if she wouldn't have known that those things were a reason to get checked out by coming to class, she probably wouldn't have. And the complications would have been severe and the outcome not as good. So information can quite literally save your life, and it's helpful to know these things going through the pregnancy and also labor and delivery. I had a conversation with a girl once. She said that her baby was 5 months old. She was having a really hard time. She was struggling with postpartum depression, and she felt like it was rooted in the fact that she didn't have a very good birth experience. She said that it traumatized her, so I asked her more specific questions about what she went through, and she described a perfectly normal experience. And that really saddened me to hear that, because I just chalked it up to complete lack of education. And again, I think that's one of the benefits of having an open mind when you go into this process is you remember that the labor and delivery process is the forward in the book of life with your baby. It's not the end-all, say-all climax of the total experience. It's just the beginning. And you'll have so many experiences and joyful events with your baby in the future. So you can't get hung up on labor and delivery if it doesn't go exactly how you planned it to go, because it usually doesn't go the way you planned it to go. So Talk with your OB provider if you have more specific questions or concerns, and they can give you the best information based on their knowledge of your circumstances. And of course, if you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.